Okay, I'd like to open the meeting for the Community and Public Health Committee for December 19th, 2023.
Hi, I will take roll. I'll start with you, Commissioner Gerardo,
Present?
and Commissioner Christian.
Present.
Thank you. I will read the land acknowledgement.
Thank you.
The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the committee meeting minutes of October 24, 2023.
I so move to approve.
Second.
Let me see if there's any public comment, please. There's no one in the room except for staff. There's no one online, so I will do a roll call vote because you're a remote, Commissioner Gerardo.
Yes.
And Commissioner Christian.
Yes.
All right, thank you. We can move on, but we're going to take the items out of order because Ms. Armstrong requested to attend a department meeting, so we'll start with Ms. Coe and to do the annual report. Actually, it is on the agenda that way anyway. I didn't realize. All right, so
Yes.
give me a second to pull it up. Okay. Yes, so just talk and it'll pick you up. You can begin. Oh, Ms. Coe, can you hold for 1 second? Commissioner, are you having trouble hearing her? I'm not picking up the microphone as much. I want to make sure that it's, is it not coming across remotely?
No, it's not coming across
Okay.
remotely at all.
Oh, wait, do you mind stepping back? I'm going to take 30 seconds and just troubleshoot. How's this? Commissioner, can you hear me better now?
Yeah, I
Can
can
you turn
hear
it
you
up some
now.
more? Can you
Okay.
do it more?
It's just on and off, so I just press it
Okay.
on. All right. Thank you. We just speak up a touch.
Yes, definitely. Thank you. Okay, I'll start from the beginning. Good afternoon, commissioners. My name is Michelle Coe, and I am a health program planner with the Office of Policy and Planning. I'm here today to present the department's annual report for fiscal year 2022 to 2023. As you're aware, the annual report is required by the City Administrative Code, and the report provides a general summary of DPH's accomplishments over the past fiscal year. I'd like to thank my colleagues across the department for their tremendous collaboration in preparing this report. Next slide, please. The annual report opens with a message and welcome from our Director of Health, Dr. Grant Colfax. This message is still under development, but it will be included in the report before the full Health Commission meeting on February 6th. Next slide, please. The director's message is followed by a message from former Commission President Bernal. His message discusses DPH's response to Mpox, formerly monkeypox, the Laguna Honda Hospital recertification, and the reopening of 3 DPH clinics, the Southeast Family Health Center, the Castro Mission Health Center, and the Maria X. Martinez Health Resource Center. Both of these messages provide our leadership's introduction to the department's activities discussed in the report. Next slide, please. The next set of sections provide an overview of the functions and services across the department. The sections start by introducing the department's 2 divisions and their roles in protecting and promoting the health of San Franciscans. The next section reviews DPH's True North and its 6 true pillars, which is then followed by the most recent organizational chart. As part of the Racial Equity Action Plan, this year's report presents demographic information on both the health commissioners and senior leadership. This data will continue to be collected and presented in the annual report each year. Next slide, please. The last introductory section focuses on the Health Commission. The section provides an overview of the structure and function of the commission, along with individual bios for each commissioner. Next slide, please. The next section of the report presents 3 feature stories that highlight some of the highest profile efforts by the department in the fiscal year. The first feature provides an overview of DPH's community-centered, nationally recognized response to Mpox. This feature describes how DPH responded to the Mpox global outbreak, which was disproportionately impacting gay men and other LGBTQ+ individuals. On July 28, 2022, San Francisco became the first U.S. jurisdiction to announce a public health emergency for Mpox. San Francisco's effective response was a collective effort of teams from across the Department of Public Health. Employing lessons learned during the COVID-19 pandemic, the Mpox vaccine team worked quickly to ensure equitable distribution of vaccines. Over 55,000 doses have been administered within San Francisco. In fact, San Francisco has one of the highest rates of vaccination coverage in the United States. DPH's response was also community-centered, partnering with numerous Black, Latinx, trans, and youth community organizations to spread awareness, provide education, direct resources, and respond to community concerns. The feature also includes Mpox metrics as of December 31st, 2022, for cases and vaccinations by race, ethnicity, age, and sexual orientation. Next slide, please. The second feature provides an overview of behavioral health services expansion of overdose prevention efforts in the fiscal year. As you know, we face an urgent and dire drug overdose epidemic in our city. In response to this ongoing public health crisis, DPH released the Overdose Prevention Plan in September 2022 and established the Office of Overdose Prevention. The plan was informed by experts at the local and state level, including those with lived experience and backgrounds in drug policy, service delivery, communication, and advocacy. The feature also highlights the significant progress made over the fiscal year to expand mental health and substance use disorder services, including opening an additional 70 residential treatment step-down beds, expanding hours for intake and treatment at various clinic sites, delivering buprenorphine to 80+ clients in 25 housing facilities, training hundreds of people in overdose recognition and naloxone use across the city, and distributing more than 135,000 doses of naloxone, the life-saving antidote to opioid overdoses. Next slide, please. The last feature discusses how DPH reopened 3 clinics in the fiscal year. DPH health clinics play a key role in the San Francisco Health Network delivery system, ensuring access to high-quality care. To address the evolving health needs of our diverse communities, DPH is modernizing and making necessary health and safety upgrades to our network of clinics. First, DPH reopened the Southeast Family Health Center, a 22,000 square foot neighborhood clinic that provides a family-oriented primary care model with comprehensive behavioral health services tailored to the diverse health needs of the Bayview Hunters Point community. The center expands the original Southeast Health Center, which first opened its doors as a standalone community-based clinic in 1979. The existing health center has been among the busiest clinics in the network, serving more than 4,000 patients annually who are predominantly low income and rely on the health center for their health care. Second, DPH reopened a newly renovated Castro Mission Health Center, the city's first neighborhood-based primary care clinic that has provided care to the Castro Mission communities for the past 57 years. The center serves almost 4,000 patients annually, and 51% of patients come from Latinx communities, and another 50% come from LGBTQ+ communities. Lastly, the Maria X. Martinez Health Resource Center, or MXM, opened in September 2022 as the new home of the Street Medicine Open Access Clinic and the former Tom Waddell Urgent Care. MXM is one of the network's 2 urgent care clinics and provides approximately 15,000 visits a year to a target population of people experiencing homelessness. Patient visits have increased by more than 25% since the move to the new building, and the clinic welcomes 100 patients per day. Next slide, please. Following the features are 24 highlights showcasing work across the Population Health Division and the San Francisco Health Network. The highlights speak to the tremendous work across the department in areas such as healthcare services, behavioral health, whole person integrated care, population health, the Office of Health Equity and Central Administration, as well as at Laguna Honda Hospital and Zuckerberg San Francisco General Hospital. We have incorporated feedback from last year to add more data points on patients and clients served by each program in order to better showcase the scope and scale of these programs. Next slide, please. The next major section of the report focuses on data, starting with DPH's budget. Budget data provides information on expenditures by program and by type, revenue by source, and major investments. For example, DPH's fiscal year 2022 to 2023 budget included historic new investments in the department, adding 400 new positions to expand services, respond to critical community needs, and strengthen overall infrastructure. Next slide, please. The next data section highlights San Francisco Health Network data on visits, patient demographics, and payer type across the major systems of care. In fiscal year 2022 to 2023, the network served more than 125,000 people across our clinics and hospitals. This section also highlights how the network provides a wide array of services across the continuum of care. Unique patients or encounter data is provided for each of the service areas: primary care, behavioral health, whole person integrated care, jail health, dental care, home health, emergency, specialty, and urgent care, and diagnostic and ancillary care. Unique patients, patient days, and average stay in days for skilled nursing are also included for ZSFG and Laguna Honda. Furthermore, this section also includes patient demographic data by race and ethnicity, by age, by sex, and by gender. In addition, payer data that showcases payer sources at ZSFG and Laguna Honda hospitals is included, as well as within primary care and whole person integrated care. One important change to highlight is the reporting of behavioral health data in this year's report. As is noted in the report, mental health and substance use disorder service metrics were previously reported specific to specialty care within behavioral health services. This fiscal year, the metric was broadened to encompass mental health and substance use disorder services across the San Francisco Health Network. This change allows us to provide a more accurate representation of BHS and remain consistent across publicly available metrics. Next slide, please. The report ends with an overview of the department's service sites and contractors. Included in this section are maps of the DPH primary care and specialty behavioral health service sites, which have been updated to reflect location changes, and a list of our community contractors is provided. Additionally, each of the Health Commission resolutions adopted in 2022 and 2023 are included. Lastly, the report includes additional DPH resources, such as where to find more information on the Health Commission, where to get health coverage, and San Francisco's COVID response. Next slide, please. I'd like to again thank the staff at DPH for their collaborative work on this report. Moving forward, we will continue to incorporate additional feedback to the final report and presentation to the full Health Commission on February 6th. At this time, I'm happy to take any questions or comments. Thank you so much for your time.
All right, commissioners, there's no one on the public comment line, so please feel free to ask questions or make comments.
Commissioner Christian, do you have comments?
Just want to say thank you for the report and for its clarity. Can you remind me what we mean when we talk about specialty care versus in the context of mental health substance use disorder, the distinction between specialty services and what I guess the department considers more basic services?
Yeah, so the change in metric is that the specialty care services are those within the behavioral health service division of the network, and we're happy to follow up with a more comprehensive list of those service types. And then the broadened metric is for individuals with a mental health or substance use diagnosis that received at least one service in the San Francisco Health Network during the fiscal year. And so those services can include a range of behavioral health services in both specialty and non-specialty settings.
Okay, it would be helpful to have
the
that
list.
distinction,
Okay,
made more clear in the report.
Okay, perfect. Thank you.
Otherwise, I don't have any other comments.
Thank you.
Great. I wanted to, I have a couple of comments. I want to thank you from last year. Comments to this year, including the number of patients as well as the ethnicity. It's very helpful to have that information. So for example, with the MXM clinic, I was very, very surprised with the number of patients that were seen in the clinic over the year. I mean, it's fabulous. And it's a significant, as I think you mentioned, like a 25% increase from the previous year. Something like that, though, which I think is not only, I mean, there's many things in the report that stand out, but that one is a bit glaring, so to speak, in the hard work of the staff. That should really be highlighted in the media. So things like that within the report, I would really suggest you alert the communications team, because everything seems in the media is negative. This is a real positive. And you've got a number of positives changes in your report. So if you could just even highlight, you know, the three, one I would vote for would be the MXM clinic, you know, to highlight within the media on the 2020, this year's changes and response to the community need.
Definitely.
Just a suggestion. Like I said, things always seem to be so negative. And even with behavioral health services, there's been, when you look at the numbers in the report, we're serving a substantial number of people. And I might note, and again, for the media's purposes, I did present Dr. Cunnen's information to the commission in November. She had given a slide report, which some of her numbers are reflected in the overall report. And at the San Francisco General Hospital Foundation Committee, they were very surprised on how many people that we were serving, and the fact that the wait time to walk in to a methadone clinic to get methadone to get help was 1 day versus the negative. So if you could just, I mean, just a suggestion that I think would be great for the public to hear.
Definitely. Thank you so much for that feedback.
That's a great comment, and I definitely support that, especially given the amount of information that we do have, and which was presented also at the Treatment on Demand hearing. And I think there are even some slides probably from that presentation, which might be useful for the report.
Thank you so much.
That's all I have.
All right, thank you so much.
Thank you. Thank you, commissioners.
Thank you.
And we
Thank
can
you.
move on to item 4, which is the maternal child adolescent health update. Ms. Armstrong. One second to pull up the.
Sure.
I'm having trouble sharing my screen, so commissioners, give me a second, please. Apologize. Okay. All right, ready to go.
Good afternoon, Commissioners.
Good afternoon.
My name is Aileen Armstrong, and I'm the Director for Maternal Child Adolescent Health Section. Thank you for having me back. Next slide, please. During my presentation, I will be providing an update on the following programs: our home visiting program, preterm birth chart review, along with our epidemiology work, and an update on our family and children's services, public health nursing unit, and some good work that's happening with our child health disability program. Thank you. Next slide. So just an overview of all of our home visiting program. We have public health nurses that provide one-on-one to participants who are enrolled in the program. The home visits are done in the home, in the community setting, and we serve our most vulnerable population for pregnant and postpartum birthing people, as well as children. And we provide assessments on infants, and we do assessments on our pregnant and postpartum moms in collaboration with orders that the doctor may provide. And our public health nurses, they receive referrals from a number of places. We get referrals within our San Francisco Health Network. We get referrals from clinics, and we also get referrals from outside sources as well. And we also do a lot of collaboration internally amongst our maternal child health programs. We have a referral process where WIC make referrals to ensure clients get enrolled in the WIC program. We have other programs like Black Infant Health. If the client identifies Black African American, they get referred to Black Infant Health. So we really streamline our processes in terms of ensuring everyone get access to services. Okay, and also part of the component is building a trusting relationship from the beginning. And I'll go into a little bit more detail about the various programs. Next slide, please. Our Nurse Family Partnership is an evidence-based program led in the community. It's statewide, and Nurse Family Partnership in San Francisco have been running over a decade. And we have some very promising data that shows where when a client have one-on-one support by their public health nurse, the public health nurse follow the client. These are first-time new moms. They follow them from the beginning of their pregnancy up until 2 years of age. And the data is shown that when a client is seen by their public health nurse, they're 48% less likely to suffer child abuse and neglect. There is other promising data where we have clients who may need their kid may need developmental care. The public health nurse support that mom through the process, and the baby gets all the support that they need over in that 2 year. So by the time they graduate from the Nurse Family Partnership, we see some very successful outcomes. This program is federally funded through also various grants. We have served during the fiscal year 2023, 314 families were served, which means that we've done 2,559 visits during that year. And during the pandemic, we fell a little short because of staffing that had to be deployed. We're currently working now with HR to ensure that vacancies that were not filled, that we get those positions filled. So we're excited that right now there is a new public health nursing list that's open, and we're hoping to recruit a diverse pool of nurses to support the Nurse Family Partnership Program. Next slide, please. Our field public health home visiting is one of our traditional, one would call it 90-year program that's been around for some time, but definitely over three to 4 decades. And field is also modeling after Nurse Family Partnership, where it's becoming evidence-based informed. We're using tools that are showing promising results for not only the pregnant and postpartum mom, but also for their infants. Our team is currently piloting a trauma-informed model, adverse childhood experiences, which is a research project to ensure that clients enrolled are engaging with resiliency and mitigate important outcomes such as where if a mom had maybe in a domestic violence situation or have had trauma in her own life, we're helping her to get the tools and resources to navigate while she's caring for her baby so that we can see those positive outcomes. And the programs that we are piloting with in collaboration is Sonoma and Napa. And this funding is through the California Department of Public Health. And the evaluation is UCSF School of Nursing. And we're excited that we've been, this is going to be going on for another couple of years. So this is, I can hoping to report back some of those findings as we continue to keep doing this good work. And then our public health nurses, they work with the clients by building relationships. They set goals. And this program is only anywhere from 6 to 12 months. Whereas the Nurse Family Partnership, the enrollment is a 2-year program. And during this fiscal year of 2023, we had 793 families served, and that in terms of 3,233 visits were seen. And if there's any vacancies, once again, we will be looking to recruit to fill those vacancies this upcoming year within 2024, and hoping that it'll be done in the first, within that, before the quarter third is over. Okay, next slide, please. Our perinatal stabilization program is new for maternal child adolescent health section. And this program was birthed due to our very, very hard to reach vulnerable population that are at risk with substance use, homelessness, and other possibly chronic health issues that impacting them from health in their healthy baby. And so it's community and street-based. Our public health nurses, in collaboration with San Francisco Health Net, one of their physicians, they they go out into the trenches and make sure that those vulnerable moms are linked to care, to services like Team Lily, also getting access to a public health nurse and any other community resources that will, follow them and, till we see some desirable outcomes. And they get linked to mental health services. The care includes health assessment and other additional education, helping the mom to bond with her baby. If there is opportunity to promote breastfeeding, we will do that educational piece. And then also, oftentimes our public health nurse will support the mom in ensuring that they follow through in their residential, if they have to go into a residential treatment care facility. We have someone that keeps an eye out on the participants. In fiscal year 2023, we served 168 clients, and which means 464 encounters. We're still building upon this. We have a plan to track the data and continue to look at certain metrics to see if we're turning the curve. And that's with all of our programs. But the most important thing is to stabilize the clients. Okay, next slide, please. This is a client that most recently who went through the Nurse Family Partnership and was given an opportunity for some housing that I forget the name of the new housing that they just launched, but she gave credit to Nurse Family Partnership for being instrumental in helping her during challenging times, and also ensuring that her and her baby are safe and that they're housed. So some of the home visiting barriers is housing, of course. We work in collaboration with our community-based partners, such as Homeless Prenatal, to ensure that moms who identify that don't have housing, to support them and walk them through the process to getting into the on any type of listing from the mayor's office. And then also, walking them through, if they have to get into a short-term rental, we help them with that as well. And especially while they're pregnant, to minimize and mitigate any stressors that they may be having. And also definitely referring for untreated mental health services. And so one of our successes that when clients are enrolled in our home visiting program, we do screening for the Edinburgh screening tool. And if their scores are high, that's an indicator that they need a little bit more hands-on as well. And we also partner and collaborate with physicians within our San Francisco Health Network, especially for the Medi-Cal population. Okay, thank you. Next slide. So our goals for our MCH epidemiology, the MCH epidemiology are to inform evidence-based action by identifying health problems and risk factors. And the team have been closely working to address social determinants of health. The team looks at local data to inform our programs and to inform our state, federal, and the local level conditions where we may need to be working on to improve. And so those are some of the areas that our epidemiology is working on. Is preterm birth is one of those areas. And I'll speak a little bit more about that in the next slide, please. In 2022, 2023, our MCH epidemiology worked to develop a new infrastructure for our preterm birth rates. And the team prepared to launch a new preterm birth chart review, and they're going to be collecting data. And this project will gradually be rolled out to all 5 delivery hospitals here in San Francisco. We've already been reaching out to our to key leadership for the hospitals to ensure that we will have access to their data, and also being able to, we working closely with within our DPH leadership to make sure that we're being compliant per the policy and reviewing chart reviews as well. And all the people who have delivered a preterm birth will be invited to participate in this survey that will be collecting data. And so we have gotten permission so far to begin to roll it out. And we're going to start maybe with 2 hospitals, one within our own Zuckerberg, and then the other hospital will be UCSF. The reason why we chose to possibly start with those 2 hospitals, because those are the hospitals for our Black African moms who had the highest preterm birth rate in the disparities. And then we also have a collaboration partnership with Kaiser as well. And we're working on California Pacific Medical Center / Sutter Health. Next slide, please. Our preterm birth rates, as you can see, it continue to be at a much higher rate for our African-American birthing people in San Francisco, and continues to be far more higher than our Healthy People goals. We not only just relying on our home visiting program to turn the curve, but we have our programs like Black Infant Health, Expecting Justice, and other community-based organizations like our doula, access to doula programs, where clients get referred to doula. And we also have Pregnancy Pop-Up, which is held on Saturdays once a month. And that's where all the stakeholders, they come together, and it's like taking your service from the brick and mortar and bringing it out to the community where moms can get enrolled into a program or access to services, or that now they also can, if they're pregnant, they can get a sonogram right there. There's a mobile van that is providing some limited care. So we are excited about that work, and we're going to continue to monitor the metrics and the outcome on those services. Okay, next slide, please. This year, the MCH epidemiology is launching and developing work to monitor the nutrition and chronic health conditions within our childcare children, as well as school-age children. And they are monitoring fruits and vegetables by ensuring that we rolled out fruits and vegetables some time ago, and ensuring that kids are getting access to it. So they're using the Veggie Meter, and it's a Veggie Meter that we invested in. The nurses and our health workers will monitor, like the little kiddos. It's a non-invasive tool where you put your finger on there on this tool, and it'll just tell you whether they're high, low, or if they're getting access to vegetables. And we also know that there's a lot of funding that went into the soda tax to prevent people from drinking a lot of the soda and sugary drinks. And so this is a way to monitor and see if those efforts that we have been doing are making a difference as well. And this method is definitely to close those gaps. So if we continue to see that we're not making any improvement, we need to change our interventions and go back and say, what else can we be doing to improve these outcomes? Okay, next slide, please. Our foster care services have public health nurses that works with our youth, and they provide increased medical compliance to make sure that all kids that are coming into the foster care system get their medical assessment. They're getting access to dental services and services that are going to mitigate any poor birth outcome. So during this fiscal year, we had 24, which we 79% compared to our fiscal year in 22-23, 69%. And so, as you can see, we're making some improvement. And I believe that once we can fill these vacancies and put more staff to work, we will be able to reach more than what we're serving as well. And as you can see, we also increased in our dental compliance as well, from 68% compared to 59%. And so those are some good data points for us, baseline, and we'll continue to monitor. Also, Safe Care is one of our evidence-based in-home behavioral parenting program, and is designed for parents and the caregivers of children birth to 5 years of age who are at either risk for any type of behavioral health issues or child neglect and physical abuse. So we have a plan to mitigate those outcomes. And so our Safe Care has found to be effective in supporting the parents and providing training to the areas where parent and infant bonding, home safety, and child health care, which have proven to prevent child maltreatment. And so this is also like statewide as well. Okay, next slide, please. So our California Health Disability Program has been looking at areas where we have a lack of speech pathologists, and it has been a long-standing shortage of speech and language services for children under 3 years of age. And it has gotten worse since the pandemic. And so what our chief, one of our medical director for our California Child Health Disability Program, she organized 2 citywide meetings with all the pediatric speech and language providers in San Francisco that accept Medi-Cal, and along with representatives from the San Francisco Health Plan and the California Department of Public Health. It was important that they be at the table because part of the issue that has been identified is that the Medi-Cal reimbursement rate is very low. So that's contributing to this outcome that we want to change. And so since working on this area in collaboration with our stakeholders, there have been 2 facilitated meetings for pediatric providers with the Golden Gate Regional Center, who was instrumental in helping resolve. And so they have been discussing how to address these areas of concern. And so this is something that I would love to come back and report on, because this is very new for us that we're embarking upon. And we're hoping that the managed care plans will also be part of this and help to streamline and how we can get the reimbursement rates at a much feasible rate for our speech and language pathologists to carry out this work, and especially for families who are underserved and who don't have the means and cannot afford a speech and language pathologist. So this is very concerning, but we'll work together collaboratively to address and fix this problem. Next slide. So that's my updates for maternal, child, adolescent health programs. I'm happy to take any questions. Thank you.
Commissioners, there's no one on the public comment line or in the room, so please feel free to comment or ask questions.
So if I may, Commissioner Gerardo, I just want to say thank you for this report and for this small dive into the really important and impactful work that you're doing. I had some questions about a number of things. I appreciate the fact that you probably wanted to keep things at kind of high level and for us, but I would encourage more detail. Some of the things you spoke about that weren't on the slides would be really interesting to have documented on the slides themselves for us to hear a little bit more of what you're doing and how, because it's such amazing work. So please be less shy about telling us about it. We have time to listen, and we are deeply, deeply interested and in need of knowing what we're doing in the city, what you're doing through your work. I was especially, you talked about youth who are in foster care, or parents who would go into residential treatment, who need to go into residential treatment. What happens to their children when they do go into residential treatment if there's already like not a foster care situation, or if there's not family? What happens to the children?
So we, for the foster, so you referring to like, just say for perhaps if it's a stabilized, one of our clients that are
You can
going-
just start with somebody going into residential.
So our goal is to support the mom and baby is the best of our ability. And we have a team of, that works together, the public health nurse, there, we have a medical consultant, and we also involve anyone that had been part of that care, that team, did the wraparound services with that mom. They would have a host of like a case management meeting, and they would strategize what is the best outcome for this mom, okay?
Mhm.
Just say if a mom just delivered and we know that she they tested positive, every situation is very different. You know, instead of just, you know, taking the baby away because the baby tests positive, they'll look at this, they review the circumstances, and then plus, you know, it's, if the court system get involved, then that's a different, you know, step in a different process. But in terms of for our healthcare purpose is to stabilize mom and baby, making sure that they get the best care possible. And then we will be working possibly with, you know, if there's a lawyer involved, and if we're asked to do that, we have to get, you know, permission. Does that answer your question? Or do you looking for a little bit?
Well, if you have more to say about it, I'm happy to hear it. But if not, that's fine.
Yes, so yes, from the standpoint of as healthcare professionals, our goal is to make sure mom and baby is healthy.
Mhm.
And then if there's any type of legal aspect, then that has to deal with the court system
Mhm.
and the foster care system, and HSA get involved. It's a whole different process for us.
I understand.
Because there's the family reunification, they may give mom opportunity to go get some help, and then, you know, temporary may place the
Mhm,
baby in, you know, in a safe home. And then if mom meet the requirements, then that there could be some reunification.
So there can be some things that happen legally based on whether a child tests positive for narcotics, or the parents' need.
Yes,
And so things happen outside of the healthcare setting, but there's a team in a case management aspect to support the mother and the child as much as possible.
yes.
That's great. Really interested to hear about your conversations with Golden Gate Regional Center.
So so our child health disability medical doctor had some robust conversations, because they feel like the Golden Gate Regional Center is a key link to stakeholder to helping bridge this gap for the most vulnerable children who can't afford, you know, like a high level speech and language pathologist. So if our Medi-Cal providers who are not getting reimbursed, oftentimes these children are put on wait lists, or they not getting the service at all. So part of that is bringing Golden Gate Regional Center, giving them the background, sharing the data, so that, you know, we're not going to be able to turn the curve if they are not able to support and be at the table, like with managed care and all of these pediatricians who make those referrals, and hoping that these kids can get the services they need.
Is there a particular team for children and youth at GGRC?
That I don't know particularly.
Mhm.
I can jump in if you would like,
Okay.
if that's okay. I don't want to.
Yeah.
Yeah.
The reason, Commissioner Christian, I'm jumping in is I'm part of this group.
Oh,
Okay.
great.
I'm a stakeholder, but also have been at at the meetings, and the director, Dr. Jeannie Lee, of CHDP, is fabulous, and has really spearheaded all of us and the stakeholders in the community with our frustration, particularly with Golden Gate Regional Center. in their inability to serve the birth to three population, which is their requirement under the Department of Developmental Disabilities. We had two very open meetings with them and their staff, and were a bit frustrated because they did not have the staff to be able to serve the children, nor, and they had multiple open positions and were concerned because their salary scale was low. We then took that information and frustration as a group, and this is UCSF, General, DPH, Kaiser, CPMC, all of us together as a community team went to the State Department of Developmental Disabilities, who are encouraging and doing what they can to help GGRC. Frustration continued, and 2 weeks ago, we had another meeting. It was three of us with Dr. Lee, myself, and Janice Mandak from San Francisco General. And we had that with the Department of Healthcare Services, and the woman assigned to Children's Health. It was an excellent meeting. We have asked for a follow-up meeting, and we have 3 asks pending with them. One is, as Ms. Armstrong alluded to, is funding. And that is one of the sources. She said her hands are a little bit tied, but there were a couple of other solutions that we came up with, as far as a model that Kaiser has with a parenting class that we're asking DHCS to fund, which has been successful in Kaiser, as well as being able to fund a couple of other pilots that we have talked to them about. So it's a continual work in progress to address the needs of especially the birth to 5, but specifically with GGRC, the birth to 3. So we are, in fact, being very vocal advocates on the state level to have our children served at, and the leader is Dr. Jeannie Lee from CHDP. So it's in process. We're trying, but it's a very collaborative community effort.
Truly, yeah.
So does that
Well,
help?
It helps me. Yeah.
Yeah.
Well, speaking for myself, and I would guess for Commissioner Gerardo, we'd love to have you back as soon as you are willing to come back and give another presentation, more detail if you would like, or maybe focused on something in particular. And I'm sure Commissioner Gerardo would be happy to talk with you about that.
Right.
Yes, I totally agree. And especially that nurse family programs that you listed. I know how important they are. And I remember as a first 5 commissioner, when we were able to get the funding, or the funding was made available, how important and excited those of us in early childhood were. So I think coming back with even more information on that would be helpful. And one of my questions within those programs, and I know how significant they are, do you also partner with a child trauma research program and the infant parent program for trauma? For the families, the birth to 5 families in their pre and postdoctoral programs?
Yes, we do partner. Are you talking about the program that's outstationed within our network, at Zuckerberg? Is that the one you're referring to?
That one at UCSF,
And then
Dr.
UCSF.
Alicia Lieberman's program?
Yes,
Yes,
yes, yes,
that
we
one,
do
yes.
partner. Yes, 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 we do. I do wanted to share, we have a success story for a client who graduated from Nurse Family Partnership, who went through some very, very challenging dark times during her tenure in that program. And recently, I was informed that this former alumni participant of Nurse Family Partnership, is currently enrolled in UCSF Nurse Midwifery Program and will be graduating as a registered nurse and a midwife. So that's, from some great work that Nurse Family Partnership have done over the years with clients. And I have other very great stories, but this one stood out so well because this client, from, some situations that happened in her life, she shouldn't have been, if you look at the data, she wouldn't have been here, but she's here and will be graduating soon.
Great.
That's amazing.
Fabulous. And I have one more question for you. And I want to thank you for answering my questions ahead of time too. It was very helpful. But of course I have one more question. When I had asked about the referrals for the nurse programs, and you said the majority have come from Zuckerberg, as well as the different family health center clinics. And I'm also wondering, do any of the referrals come from any of the homeless shelters, such as Oasis Inn? Or do they, how would that work with, let's just say, Oasis Inn, which is the mother-child homeless shelter that also has pregnant moms?
For Nurse Family Partnership specifically, we get referrals. I just named those few, but if it's a first-time new mom, many programs know about it. And if the mom is pregnant in the shelter, they'll definitely get a referral. We also get referrals through our electronic health record, Epic. And those, a number, we get a lot of referrals for all of our programs that, are in Epic and they come through. But yes, from shelters, from housing agencies where a mom is pregnant, and whether they're first time or this is their second baby, those referrals come to us. Yes.
That's wonderful. But I think too, when Commissioner Christian was talking about data, just even that amount, just that information for us, I believe would be really helpful to further understand the scope and breadth of the area of your programs.
Okay. Okay, will do.
Thank
I'd
you.
like to learn and further understand.
Yes.
Yes. Could even be maybe a session that was just focused on more information about this work.
Okay, will do. Thank you so much.
Thank you,
Okay. Thank
Happy
you.
holidays.
Happy holidays to you.
and Happy New Year.
Thank you.
All right, commissioners, we can move on to item 5, emerging issues. I'm not seeing or hearing anything from you, but we do now have 3 people on the public comment line. I think they're all staff, but folks on the line, if you'd like to make comment on emerging issues, please press *3. Okay, no hands, commissioners. We can move on to item 6, public comment. And folks, this is a time to make comment about any topic that has not been on the agenda today. Please press *3 if you'd like to do so. I see no hands. And so commissioners, please consider a motion to adjourn.
So moved.
Second,
And so Commissioner, I need to do a roll call vote because you're remote. How do you vote on this issue?
yes.
And Commissioner Christian, how do you vote?
Yes.
All right, thank you so much. Thank you everyone for attending. And again, happy holidays, happy new year to everyone.
Good to see you, Commissioner Gerardo.
Oh, thank you. And it's good